Physicians are very interesting, and one of the things we found with some of the studies is that patients really align with their primary care physicians. And so what we want to do is say, okay, how do we encourage and incent those primary care physicians and help them get to a point where they can really do a better job of taking care of their patients? And one of the ways that we've been doing that is with technology. And also we're providing transformation services, people going into their offices and helping them getting to where they need to go. We're very fortunate. We have several physician champions who were very resistant to this kind of change in the beginning, and after a period of time realized how more effectively he was able to manage his patients and take better care of them. And so we found that by using physician champions in physicians' offices to tell the story and show them how their practices could be more efficient, how they could really manage patients in a better fashion, that's been extremely helpful and very powerful. And when you have a physician champion leading that charge, and rather than a hospital administrator or someone who hasn't done it, it makes a huge difference. Physicians are not customers or not consumers, or they're not just people who practice here. They have to be partners with us on the business side. On the business side, to really work together to do the right thing for the patient. So that was our premise. And so what's happened over time is we've engaged physicians in the community, we've engaged specialists, we've engaged federally qualified health centers. And the thing that's fascinating to me that I never saw before is that physicians themselves are really engaged in doing things right for the patient. And part of that is because now they have the tools. We always wanted to do the right thing for the patient. I think that was something we always felt comfortable with doing, but we didn't have the information or the tools to do it. Now, with this technology and with the desire to do the right thing, and with the government and the payers saying, look, we need to go in this direction, I think it's going to be just an exciting time, and the physicians are extremely critical to this. Our board, our Arizona Connected Care Board, is made up of mostly physicians, and I think that's what makes it so powerful, because they're driving this.
It took a lot of coaching, convincing, and arm twisting to help me transform and make that change. Now, I've had the opportunity in my career to be on both sides. I'm on the other side of the fence. I can tell you where I've been going, and where I am. And where I am now is a place which I wish other physicians that are reluctant to make the change could see. But we can't see that because, we're mired in our daily workday processes, and it's very hard for us to see beyond our day-to-day office hours. Yeah. But now that I can see that, the change has been dramatic, and it's done wonders for patient care and for reducing healthcare costs, in not only in our office, but I think in the country.
The challenge for nursing is that we don't have the time to have the deeper conversations that need to be had. And so I see in care coordination the prioritized focus on quality care from the patient's point of view, and being able to articulate to multiple providers and an interdisciplinary team what's important to that patient so that we can come up with a plan of care that's going to be realistic. The nurse's role in care coordination is so exciting because we can focus on the patient when we walk into that room and look the patient in their eyes. We can ask them, tell me what's important to you. Sometimes I look at my patients and I say, you've had 5 different physicians in this room, along with a dietitian, a physical therapist, a pharmacist, nurses, PCTs, and I want to know if you've had a chance to say, what do you want? Have you had a chance to process when you leave the hospital? What are you going to be able to do? What does this mean to you and your family and what you really want in your life? We focus so much on the physical patient in the hospital, and we're trying to coordinate what's important to the patient emotionally, physically, and spiritually. And I think having the focus on a full-time position that can spend that time with the patient, establish a trusting relationship, that interpersonal relationship with the patient to know what their goals are. I've had many conversations with patients about their lifestyle, how long they've had a chronic disease. I can't imagine what it's like to deal with diabetes and heart failure and pneumonia all at once. What would that do with me emotionally? What kind of depression is involved with that? And would I be willing to adhere with 20 medications and 3 different diet restrictions and activity limitations? And so I really try to get into the core of what makes a patient tick. I think nurses have always sensed that for years, ever since Florence Nightingale, that we know what patients need, but we haven't had the time or the resources to give that to them. And we're starting to find the way to have the resources to give these patients the skill to succeed with their chronic diseases.